Welcome to another episode of Edible RX, the podcast that teaches autoimmune warriors to use anti-inflammatory food as medicine. I'm Laura Rodriguez, holistic chef, autoimmune warrior, and backyard farmer, and today I'm having the amazing local chiropractor and functional medical practitioner, Amber Greer, on for an interview. We're just going over all the things. We really get into it in this episode. Nothing was off the table. We just sat down for a really nice casual conversation about her journey with autoimmunity and how she got into functional medicine and how you too can take control of your autoimmune condition, take control of whatever condition that you have with the help of functional medicine by listening to your body and giving it what it needs. Just an absolute amazing conversation. I cannot wait for you to hear it. So let's go ahead and jump into it. Hi, Amber. Thank you so much for being here with me today. I am so excited to speak to you because I want to tell you, just candidly, I don't really know very much about you, but I'm very impressed by you. I met you recently at an event that you hosted at your workplace, which is Music City Health Center, correct?
Yes, correct.
Okay, so tell us about yourself. So you are a chiropractor, a functional medicine practitioner. Tell us more about what you do there.
So I am a chiropractor. I got into holistic health purely for selfish reasons. I think I shared some of that at the talk. But I started out in chiropractic because I wanted to provide care for people. And I will be really honest, whenever I first went back to school for this, I had no idea we meaning a profession, we were as crunchy and holistic as we are. Because growing up, I was involved in a really serious car accident. We almost died, and I was tiny. If you can believe this, I'm old enough to be in the generation of people that didn't have car seats.
Oh,
And
yeah.
so I was injured really badly, head injury into my face. The doctor said I may not talk or possibly walk. It was pretty tough. My mom was
Wow.
pregnant with my brother at the time, so it was a really tough accident. And my mom just had the wherewithal to take me to a chiropractor. Her
Wow.
neck had been injured really badly. And so that was kind of my first connection with the profession. And I went for several years. Obviously, I can talk. I do also sing professionally. So like my mouth and face work. Right. I did have to have some surgeries, but all things considered, not too bad.
Wow.
But that was my first connection. And so I really didn't understand that there was such a different from mainstream medicine. And so when I went back to school to be a healthcare provider, I just knew that I really wanted to help people in a way that I had been helped. And then prior to going back to school, enter autoimmune disease. My body was falling apart. As I mentioned, I was a singer and in this really competitive, cutthroat profession. Not that there's not cutthroat in every profession, but that's how I grew up. I grew up being pushed out on the stage and performing, and I loved it, but my body was starting to talk to me. And I didn't know how to respond. With autoimmune disease, it's like the switch flips, and then it's just this whole cascade of just the storm. So that started happening in my later teen, early 20s. And I just was searching. I could not accept what doctors were laying out for me. And I knew chiropractic was a type of profession that wouldn't involve my cutting anybody open or, being in an ER. And so I began to dig for myself, and that drew me in. And I went back to school, and I didn't add the functional medicine piece until later. I was actually in practice and watching people under care get better, but I was still really sick myself. So I began to add in functional medicine and additional postgraduate education for that to be able, there's more to it. There's more to this body, and the adjustments, while I love them, the adjustments it's like they weren't enough for me. I still needed more. And so that's what started me on that journey. And it's been crazy. I am healthier now at almost 43 than I ever was in my teen years and 20s and then 30s when I was having babies. So it's really changed my life. And I don't want anybody else to experience the years of struggle with autoimmune disease that I had. If there's any way I can be the waiver of the red flag, to
Yeah.
say, hey, there's another way.
Mhm.
That's why I get up and do what I do and work outside the box and work outside of mainstream.
Mhm.
Um, so yeah, that's the short version.
I love that. It seems like your life kind of came full circle and it was really saved by chiropractic and now you're saving others that way. But with that added, um, work that you do when chiropractic can only go so far. So let's just touch on lightly some of the other services that you offer your patients then. Is it,
Yes.
mhm,
So with and of course, I want to be really clear. There's always a place for, of course, emergency medicine, and we're obviously really thankful for the healthcare testing that we have access to in this country. Even though when you go to mainstream, the biggest issue I have is that women are coming to me and it's like, I've had this lab done and everything comes back normal, right? Everything comes back normal whenever you get a panel from your mainstream provider. And I try to explain to people, I do explain that those panels are normal because the panels are designed to result in treatment with medication. So
mhm.
one level off equals one medication to help you. And one medication, if you don't already know, one medication, it's just like autoimmune disease, they bring buddies, right? I don't have one autoimmune condition, I have three. One medication results in two and three and so on, the longer we're on them. So with functional testing, the tests are different. The panels, I do, I'm going to have you poop in a cup, right? I have a lot of people that do our functional stool testing to help understand GI, the health of your gut microbiome, not just pathogens that make you sick, but where is your level of wellness, right? That's what we want for you. And then how to fill in those gaps. So nutritional testing through that. We do food allergy and sensitivity testing, which has been amazing to get the gut started on the right path to get achieve more gut health. I test women's hormones. I generally prefer urine panels for hormone testing. It's a little different than a blood panel, but we do test blood as well. And of course, saliva if we need. We do heavy metals testing, neurotransmitter testing via urine, heavy metals looking for heavy metal toxicity, right? So there's all of these other pieces that we're just not given in our day-to-day. Our medical system is not really designed to help you in your day-to-day life to stay healthy. We
Mhm.
have incredible emergency services, but day to day, if your body, if you want function and health without it being connected to a pill, you're just not going to get it in our system. And
Right.
so that's where providers like myself come in, and it starts with how we're going to test you. It's
Mhm.
not the run of the mill stuff. And yeah, it's gross to poop in a cup, but you know what? We're going to learn from that.
Yeah. So you touched on it a little bit in the beginning. Let's really go in depth here. So you said you have 3 autoimmune conditions. What are they?
So my first one was autoimmune thyroid condition. They called it just our autoimmune thyroiditis back in the day. I was never really labeled with Hashimoto's, and I now understand like the markers to give you Hashimoto's. Hashimoto's falling into the hypothyroidism. So autoimmune hypothyroid meaning your thyroid just isn't working, isn't performing. So I started out with that diagnosis at 19. And then I was shortly diagnosed with PCOS there afterward. So I began to gain a lot of weight and kind of got the spare tire tummy really early on. So PCOS was really difficult. And I got the ultrasounds done, all of the things that would verify that I was just full of cysts. And then ulcerative colitis would come on a few years later.
Wow.
And I will say I was medicated for PCOS and medicated for infertility issues that came with that. And then as a result of those medications, after several years, my guts fell apart.
Mhm.
So the ulcerative colitis, I didn't receive that diagnosis until I was 28. And it's still the most difficult and can be the most debilitating because, if I am in a flare, um, it's difficult to function. So I'm very transparent about that. My body is not this perfect picture of health, but compared to where I was, and now knowing how to treat my triggers, knowing how to treat my body when I find myself heading toward a flare, right?
Mm-hmm. Mm-hmm.
That's been the life-changing information and how to take care of myself versus, popping all of these steroids and these biologic medications that come with a slew of other side effects.
Mm-hmm.
So again, the colitis is also the most scary. Visually, if you don't know what it is significant amounts of bleeding in the stool, and it's just disturbing when you go to the bathroom. We talk
Mm-hmm.
a lot about poop in my practice, but
You're in a
it
safe
is
space. It's okay.
right. Good, great. But it's really difficult because I really felt like, oh my body is just letting me down. My body, I have all these ambitions, and my brain is up here, and my heart and my drive, and my body is letting me down. So there's a lot of depression that goes with that, a lot of self-doubt, like, how am I going to ever be able to do the things that I want to do for my patients, and of course my children and my loved ones, whenever my body just keeps letting me down.
Mm-hmm.
So that's been probably the most difficult one. And then overhauling, how I talk to myself, just that inner dialogue of your body's not letting you down. It's trying to communicate. Symptoms are communication. You just have to know how to respond and then interpret that. Um,
Absolutely.
and the functional testing it's helping you. We've literally taken every bit of, saliva, blood, urine, whatever that your body makes, and put together the pieces for you.
Mm-hmm.
Um, so that's
Yeah.
definitely the most difficult, like I said. And I think I shared this earlier, and I do let patients know, but I have been completely med free for almost 7 years.
Oh,
So
wow.
that's been really incredible because your body, my body started to change quite a bit with all the steroids and meds.
Mm-hmm.
That just wasn't fun in my mid
Mm-hmm.
30s.
Yeah.
Right.
So let's get into
So,
it. So, how did you go from being on medication to where you are today, living medication free? Let's talk about the journey. I know they're probably very different for each condition, but there must be some underlying common thread that you think maybe exists to where you can still live
med
medication free at
free.
this point.
So absolutely. So some of these, well, the medications that were suggested, I guess the more scary ones, they're scary to me because they're new. And, when you start these things, you're generally told you're never going to be able to go off of them. So I got started whenever I first found out about some of the labs that I use now for functional testing. I was just on the front end of my education for that, and I just got the food sensitivities test. That was my very first thing, because obviously for me, my guts are falling apart. It makes sense that, we've got to change the diet,
Yeah.
right? We've got to change. And even at the time, I was eating what I knew to be clean and healthy, and
Sure.
I had gone vegan and smoothies and just doing the best that I could do. And
Mm-hmm.
so that was my first step. And
Mm-hmm.
I connected with a lab that I use, and I just started offering it to patients. I had zero hope for myself at that point because I needed to go and prove it.
Mm-hmm.
So for the first 6 months of getting my feet wet with that, before I introduced the stool and then the other components, I just started offering to patients, and I just sat back and watched them.
Mm-hmm.
And it sounds cynical, but I had to have more proof because at this point I had tried everything, right? That's what I get every day that comes into my door. Like, oh my gosh, I'll do anything because I've already tried everything.
Mm-hmm.
All right. So I watched them get better, and I had a lady, and I'll never forget her. She had really severe rheumatoid arthritis. She, as a chiropractic patient, she couldn't lift her arms. So her shoulders, she couldn't raise her arms to put on a shirt. She could barely get the fork up to her mouth to feed herself. Okay. And she was really struggling. So, her pain complex was high all throughout the body, but it was really in her shoulders, and she had a lot of damage. And so I started her, and I thought, and she was in her 60s. And I thought, okay, if she can do this, if this person improves, I will jump on board for myself. And it took her It took her 3 weeks of really being and you're talking about somebody who, lived off of, white bread sandwiches and, this certainly isn't a shot or dig at this person, but she just had zero knowledge
Sure.
of healthy food versus unhealthy. It was just whatever she ate is what she ate.
Sure.
So she overhauled. She kicked and screamed and wasn't real happy at first, but she overhauled her diet and followed those restrictions. And within 3 weeks, she was able to raise her arms overhead. Now
Wow.
that's huge for her because she
Yeah.
raised her arms and she just started crying.
Yeah.
And
I'm
I'm gonna
about to
cry a little
cry.
bit talking about it. But she was kind of that final one because other ladies that were kind of seemingly healthier, they started doing it and they were like, oh my gosh, I've lost 10 pounds or my belly looks great. Or I had one lady that lost 20 pounds in her first 2 months of doing it. But this lady with the rheumatoid and that type of condition, just after a few weeks to be able to raise her arms was incredible. So I finally took the test for myself. And did the things. And it was like, oh my gosh, I can't eat any of the things that I know about.
Hmm.
So, and it's not take away things that I love. It
Sure.
was, okay, so what do I get to have now?
Hmm.
And
Yeah.
being able to make those changes and then really digging into, as all of the there's the AIP protocol and the
Hmm.
FODMAP, and then of course you have keto and paleo and these just endless amounts of diets that, still aren't really customized. So the foods were step one in learning about all of the things that triggered my inflammation, how to stay out of that flare. And it's kind of gross, but I was not even able to submit a stool sample at that point. So I
Hmm.
had to begin eating the way I could eat to get on track with my belly, and then made it to being able to submit stool sample within a couple of months because
Hmm.
my stool was just awful,
Hmm. Hmm. Yeah.
So the foods were huge for me.
Yeah.
And, just helping people understand, like, I can adjust you every day. Unfortunately, if you are taking some sort of pills every day, nothing affects you the way your food and what we put in does. Externally, adjustments and other therapies are wonderful, but they're not going to hit the cellular level as the
Mhm.
way that our foods do, right? You do
Yeah.
this 2 to 3 times a day, right?
Yeah.
So that was huge and that starting point. And then of course it was just like, all right, we got to do more. We got to dig deeper. There's more to this.
Mhm.
But the food
At that
test.
point, were you still eating like processed foods? Were you still eating, gluten, dairy, anything else that's like highly inflammatory? Or were you, um, or was it more so like I really need to take out nightshades and nuts and seeds and whatever else was specifically causing you some inflammation?
Yeah. So by the time I had reached that point in career change and education, yes, I was away from processed foods. We were pretty, full organic in our household with everything that we did eat.
Mhm.
Um, had the kiddos on a good plan, but most of the, processed rice and soups and things that we get from the grocery store, those things were already gone from my life. And I
Mhm.
still wasn't better.
Mhm.
So for me, it was interesting that one of my biggest triggers was actually rice and peas. I really struggled with legumes, and I
Mhm.
was living off of this vegan, a vegan based protein product that seemed like a wonderful thing, right? All the
Yeah.
label said all the right things. It was organic and clean. And that was the biggest bit of inflammatory on the test. You see how inflamed each item makes they've kind of got it on a sliding scale. And the rice and peas and cashews, I really struggle with some legumes and nuts. But those were the most difficult thing for me at that time.
Mhm.
And there were some other things that were spices and herbs. And I kind of joke, I was living off of that vegan smoothie and then this ginger tea. And ginger is something that my body was like, oh, pump the brakes, you know?
Wow.
And I never would have known that because ginger is healthy, right?
Yeah,
Ginger
sure.
tea for the
And
gut.
usually marketed or, identified as being an anti-inflammatory
Absolutely.
ingredient. Yeah.
Yes, absolutely. So anti-inflammatory, helping with your joints, all of the things that you think of, I was trying to do. I just had to get a specific picture of what my body needed. So I cut the ginger, I cut the teas that I was drinking. I actually had reactivities to green tea and black tea. Girl, I was living off of tea. That's the only
Wow.
thing that felt soothing. Cut all of that, and got on a plan. So inflammatory, obviously non-processed, right?
Mhm.
Plus that extra layer of this is what my body needs and can't have.
I love that. So let's talk about, because I feel like there's a lot of emerging science that shows that like food sensitivities are often linked to leaky gut and or gut imbalance. And so if you were to work on healing the gut and you were able to really spackle that gut and close up that permeability and then also balance your gut microbiome, you should be able to reintroduce those foods that you were previously sensitive to. So did you find that was happening in your case, or are you still not eating peas and rice and ginger and all that stuff, cashews?
Oh no, that is a great follow-up question, ma'am. So yes, kind of our next step, once I was able to do the stool testing. So we look at, yes, you have these sensitivities, but you're spot on. Why do you have them? What can we do to keep this from continuing? And that is cleaning up the gut. So that's where the stool test comes in, because I actually had, this is about to get gross, people. I had parasites. I had been hospitalized 2 years prior to this. I'd had a bad reaction. I was just really weak from being in a flare. I'd been in a hospital and picked up a very common bacterial infection. I had no idea that infection had set up shop. My leaky gut is a nice way to put it, right? But leaky gut to the max, parasitic infection, bacterial infection, and then additional yeast infection in the gut. So
Wow.
these things
So
were
candida overgrowth, did you have SIBO, or when you say
It's not
bacterial
considered
infection?
SIBO. I
Okay,
had candida. It's kind of gross, but small intestinal infection. It's just higher up. It's kind of like where the problem
sure.
is located in the gut. Mine was all, and parasites, by the way, parasites can burrow into the liver as well. So parasites are just they were everywhere.
Yeah.
And the gut yeast infection, yeast overgrowth. So yes, it was top to bottom. So, I also now run a blood screen for candida as well. So we
Okay.
can see, because candida, you may already know, but candida gets in the bloodstream and can cross the blood-brain barrier and can, further add to your slew of symptoms. So I call it the trifecta. So I
Mhm.
had bacterial infection, parasitic infection, and this huge yeast overgrowth. And quite frankly, detox and cleaning up my body that first month was hell. I
Yeah.
thought, I
Die off
just,
symptoms and all that kind of stuff is
yeah,
just
I
mhm.
could barely, I was out of bed just long enough to treat patients and back in bed by 3 and 4 o'clock at night in the afternoon. I had to cut my hours. It was just a really tough time. And I was in practice just by myself. So it was easy for me to move things around.
Sure.
But the die off that month and what happened to my skin, it was in my hair and my eyes. So my eyes even started to fog, and my lids were constantly swollen.
Wow.
It was it was rough. But that's how we get that gut clean and then healthy. So you remove the interference and then start that repair work so you can have restoration and not live in this bubble of extreme restriction your whole life, because that's
Sure.
not living either. Do I
Right.
care that I have to give up peas and rice? No. And yes, I do retest for myself every year. I retest because your immune system adapts, it changes, it heals. And I went from having 35 food restrictions to now I'm down to 4 things that I
Wow.
have to avoid and stay away from. And we talk a lot about food rotation and how to keep that gut and keep you from developing further sensitivities, right? Because it's
Mhm.
ultimately the permeability in the gut is now much improved. I do have amazing poops now, everyone. Right? It
Can we
feels
get a
so
round of
good.
applause for the
You
poops,
just,
guys?
yes, you want like this gold star, like, oh, anyway. Um, but yes, that's how you regain that health, because just getting the picture of the foods, you like, you can't live that way forever. Most people can't.
Right.
And some things will never come back. Like, I'll never bring processed gluten back into my life.
Mhm.
Not ever, no way, no how. But not in this country, right? But I just these are the things we check every year to make sure we're on the right path and we're staying as flare free as possible.
Mhm. I love that. So, did you treat the candida and the bacteria and the parasites all at once, or was there an order that you did them in? And are you doing the same thing for your patients now? Did you come to like a way that you like to do it, or is it different for every patient? What would you say?
Okay, so for myself, yes, I jumped in, and that's why I was so miserable. I jumped in treating everything at once.
Because you're
um
probably short on time and you've been sick for so long, you're like, let's just
yeah,
do this. I'm not
I
going
was
to
like,
be
just rip the
detoxing for 6
band-aid.
months and
Mm-hmm.
trying to work around it. Yeah, gotcha.
And I do, so one little caveat, especially with the stool lab, I get, of course, I want to treat you naturally. I would prefer to stay away from pharmaceuticals, but
Hmm.
my case was so bad, so I did have to get some drug therapy,
Hmm.
just to treat. I think I did meds for the yeast, actually.
Oh, okay.
It was so out of control. So
Yeah,
I did have to use a little bit of medication, a
yeah,
round of that, and then natural, all natural things for the parasites, killers for sure, killers, antifungals, antiparasitic,
yeah.
herbs and vitamins. So I did treat those naturally, but yes, I ripped the Band-Aid all at once. I had no idea how bad it was going to get. But really, after that 3 weeks, I started to see the light and turn a corner. With my patients, I do try to, because I know their whole lifestyle. So I've got to walk them through in a way that they can get better, but they can
Hmm.
also face what they have to do every day.
Hmm.
I don't, especially when they've been sick and if they've been in bed for so long. So yeah, that path of, okay, how do we get this? How extreme do we want to be? And then I always have a good timeline. Hey, you can expect that it's going to take this long for this to clear. And we do. It's like peeling the layers of an onion.
Hmm.
If I rip the Band-Aid and treat everything, that can be too hard on their bodies.
Overwhelming. Yeah.
So
Hmm.
yes, too overwhelming. And I have people tell me all the time, well, I was doing pretty well. And then we started and I felt like everything was flaring. Yes, because your body is taking out the trash. That inflammation rears up all of the cells that are designed to help you and heal you. They don't feel good in the process because the injury, that chronic injury of chronic inflammation is there. And so when those cells start to turn and turn over and get out, it is a tough process. So
Hmm.
I like to pace them. I've found that just being clear with timeline and expectation up front helps. I tell them this is not magic, but let's not forget all the medications and the side effects that come with them. How often are people coming in saying, I tried this drug and I feel awful, feel awful. So it's kind of like, where do you want to put the work in? Do you want to work to feel better from something you've gotten pharmaceutically, or do you want to work to feel better while you're overhauling your lifestyle?
Hmm.
So I don't sugarcoat it, but it is, you have to pace yourself, because if a patient is highly inflamed and infected, it's it can be too much. So I always
Absolutely.
take that into consideration and treat them effectively, but as gently as we can so they can continue with life.
Right. Absolutely. Wow, interesting. So do you test for parasites and candida and things like that on yourself now, or do you feel like you can tell in your body or are you doing like a can or parasite cleanse every full moon, or what do you normally do? Because I know everybody has parasites and it's one of those things that like I feel like most people who are sick
Mhm.
have a parasitic infection that needs to be
Right.
addressed. At least I
Right.
know I did, and I still do. We've only done, I think, 2 full moons so far of our first parasitic cleanse, so we're still working on it. But how do you go about that? Like continuous?
So yes, I do. So I will get updated stool testing. So I do that for myself. And when patients walk through the process as well, we lay out when you feel this, or if you have, if, of course, if you've been on any type of antibiotic, if someone gets sick and they feel like they need that support, we lay out stool testing can be redone after that.
Okay.
For myself personally, I do use, I call it the parasite cleanse, the light. So I use a full parasite protocol that is a full cycle, a full 30-day with patients. I've used that for myself to treat when I knew, all right, this is what I'm dealing with. We're going to do the full parasite cleanse. It's difficult on the body, but once you're in on a cleaner path, it's not as bad. When somebody brand new to the practice is really struggling, that parasite protocol is tough, but it's 30 days. And then I do the spot shot, I call it, which is your cycle of the 5 days around the moon, around the full moon. And use, I do have an actual protocol for that. Most patients, it gets more individualized, but for parasites, I love a company that I work with. It's Cellcore is the name of their products. And they are fantastic. And the other parasite treatments that I was using, this is an actual system that I love using. But for myself, and they have some kind of maintenance products. So I do use a maintenance product every day. I take it before bed, just to keep things moving within myself, they call it, the poop you can be proud of, right? To keep everything on track. So once I do a major cleanse, I will do a light cleanse with a patient. So we'll do a full 30-day, of course, depending upon their severity, but a full 30-day. And then the next month around the full moon, we'll do a light. And then some patients I have, they want to do the full cleanse every 6 months. I find that, I've got some diehards that think they want to do it every month. It's a little tough on the body. But if and we retest a stool test between a 9 and 12-month marker. If you're still struggling, the most I would do would be 3 full months in a row of the 30-day.
Okay.
And that is, that's extreme. But then there's maintenance that we do after the fact, to keep your body on track and keep them from coming back. But the severity.
So then are you doing the full detox pathway drainage before the 30-day? Or are you just like, let's get these parasites, paralyzed and out of your system?
No, that's a great question. You have to open up the lymphatics first, and I like to pace them. We set a date of, all right, here's what we're dealing with now. At the very least, I like to get 2 weeks of that lymphatic drainage started with them, because parasite detox can be really constipating in the beginning. Their bodies swell, you'll get extra puffy, right? If swelling, and of course, if weight gain is already an issue that they have and they don't want to look and gain any more weight. But yes, we've got to start with the lymphatics first and that drainage process. And then that's what I love about the products that I do use now, is that the lymphatic drainage piece is in with the system.
Oh,
So,
cool.
or you can use it isolated, right? So I do start, kind of lay the groundwork. And some people, we have to do that for a month before I can even jump into the big 30-day cleanse. And then, especially when I'm treating, I do treat mostly women, but women's bodies, we also have to consider their cycle, when in the month they're ovulating, and the difficulty that they may be having with their sex hormones. That's going to affect how hard the parasite cleanse is on their body. It really affects your energy levels. Those parasites, they don't want to go anywhere. That this is their home now, right?
Yeah, they like it there.
They like it. That's right. They love it. So, how their bodies are doing reproductively, is also taken into account before I put somebody on that cleanse. Like I said, I jumped in way too harshly with myself. But it got the job done. So I kind of joke with patients, I promise you, I've treated myself more harshly. And in order to get a good, I want to lay it out for them in a way that's doable, to where they don't feel like, okay, my life is going to end over the next couple of months because I just can't get myself out of bed. We
Yeah.
do want to be a little more gentle than that.
Absolutely. I love that. So I feel like we need to do a separate just like parasite talk because this is obviously so fascinating. I think it's one of those things that like doesn't really get discussed enough, and most people
Absolutely.
probably they think we're crazy when we say these types of things like, no, I don't have any parasites. I would know if I had a parasite, but like I think that's probably not true. Like most people
Correct.
probably have
That's correct.
parasites.
That is not true. You don't
Right.
know. So,
So you did food sensitivity testing, gut health testing. You did the co-infections and cleared out the candida. Was there anything else after that, or were you like, okay, now I feel great?
um, no. So kind of back to previously in with the autoimmune conditions, I had also I have two beautiful healthy children that were conceived naturally, but I also had a miscarriage in that mix. And
Mhm.
after the miscarriage, I did choose a DNC, and then I had a post-surgical scar tissue bleed out. And so I it was like I was never going to stop bleeding. So I
Mm,
had this bleed. I had to go back to the ER. So I had zero iron stores. My iron and ferritin were very low. The gut is upstream to our sexual hormones. And so if the gut's not happy and had been compromised for so long, there was no way my female and reproductive hormones were on track.
sure.
So in addition to the parasite cleanse and all of the gut, the poopy stuff, right, I had to get my cycles back on track. So it seemed like I was never going to stop bleeding. I bled for 6 to 8 weeks, I think, after that second procedure was done, and I couldn't get the hormones back where they needed to get my cycles back, because we did want to try to conceive again. We did not.
Mm.
And now I'm old and I'm past that. But but that was huge, because in addition to really struggling with GI pain and not being able to eat and discomfort, my cycles were getting more and more off track. So I was having them as close to 18 days apart, and that was difficult as well. So, our bodies are this one lovely piece. All the pieces work together. We were never meant to be divided up into parts. So if your
Mhm.
gut's not working, PS, your uterus and ovaries, they're right there together, right?
Yeah.
Proximity. But from
They're
a
at the same
hormone
party.
that's right. From a hormone production standpoint, there was no way my body could do what it needed to, because my immune system was on fire from what was
Mhm.
happening in the gut.
Mhm.
So the female reproduction side of things, I was a mess. And quite frankly, zero sex drive, zero
Sure.
zest. My poor husband, just hanging out trying to be supportive, but it was really interfering with obviously our relationship, and my fatigue was so high. So it's never just the one thing. Like, I
Mhm.
love it when we get answers for patients. Here's what parasites are doing to you. Parasites have spread into other systems in the body that you may not even consider.
Right.
So working on the female, and I used the urine panel for myself. I
Mhm.
actually did an extended urine hormone tracking for myself, which is about a 33-day
Oh, wow.
tracking through the urine for your sex hormones. So I did that to get all the pieces back together post miscarriage. I run those tests whenever women have miscarried a lot and they are really looking for answers because they want a baby. There is a regular one that is more of my go-to, but in extreme infertility or multiple losses, I will do the extended panel. So it's much
And that
longer.
means taking a urine sample for 30 days?
Yes,
Is it
ma'am.
at the same time every day, or is it at various
Every
times?
day at the same time. And then there's a 5-day rotation where you get
Okay,
evening, overnight,
okay.
mid-morning. So yes, you
So
collect
I'm
it.
very curious, what was your hormone panel? What did it come back? Were you low cortisol? Were you high estrogen? What was your specific panel?
Yeah, great question. I was extremely low progesterone. So my progesterone was tanking out, like, I was headed into menopause. The cortisol, my cortisol was running much higher than I wanted it to be, because I was just stressed all the time. So I was like wired, but low progesterone. And my ovulation was happening a week and a half sooner than it should. So when your progesterone tanks, you don't have what you need to have a good quality egg. The egg is not healthy. The egg hasn't had its full life cycle before it drops. And so that's why you really are prone to miscarriage, and why I had miscarried before, because yes, I had an egg, but that egg wasn't viable to make it into full-term pregnancy. So my progesterone was tanked. My estrogen was in a normal level, but by comparison, because the progesterone was so low, I would be considered estrogen dominant.
Right.
So,
'Cause
and then
progesterone controls estrogen, right? It's like,
well, estrogen is the first half of our cycle. That's what controls how you're making your egg, when that egg drops. And then when that egg is not fertilized, progesterone comes in the second half of your cycle. If your egg's not fertilized, you move on, and progesterone regulates the length of your cycle. So the length in between your bleeding days,
okay.
right? So when my
Okay.
progesterone was tanking, and progesterone is your communicator from your immune system, the immune system was on fire, and the body is really trying to protect itself. So it'll downregulate progesterone so you can't conceive. And it's really this
Because it's
amazing
saying your
thing.
body's like, you're not healthy enough to have a baby right now.
That's correct. That's
Wow.
correct. So we did, I have to walk through with patients, and nobody loves this part, but whenever you are trying to conceive, if you've had multiple losses, I actually put them through at least 90 days, sometimes 6 months of absolute using protection. I prefer that you and your partner either abstain, use the rhythm method, of course, use condoms, but you cannot conceive right now if you want to carry. We've got to put you on a path to healing, get things regulated, get those progesterone, if it's progesterone, but get those
Sure.
levels back up, because you need time to have that healthy egg that can be viable
I love that. That's
for pregnancy.
protecting you in a way that instead of just continuously, miscarrying, like
Right,
let's stop
right.
for now and let's get healthy and then let's work on that egg production. That's really smart. I love
Absolutely. Absolutely. So, and women that, I only dealt with one miscarriage. I deal with women that have had 4 and 5, and they think they can just keep trying and trying and trying. And sometimes your mainstream provider will put you on progesterone pills. Let's give this a
that. Like a
go.
synthetic one?
And
Oh, wow.
and to help them, and it's really difficult on the body. I tell my patients, I want you to conceive, carry, and then care for that baby, right? Your body's going to be if you make it through the pregnancy, then your body's a wreck, because we've had to keep all of these synthetic hormones in to keep the pregnancy viable. And I understand, of course, why women choose that option.
Sure. Yeah.
But what if we could get your eggs as healthy and viable on the front end, to where you didn't have to have that throughout your pregnancy? And then you're at a lower risk for postpartum and some of these really difficult things when you got this new baby that is literally sucking the life out of you,
Oh,
right? Right.
absolutely.
So we want healthy conception and pregnancy and then beyond, right?
Yeah. Wow. So your story is going to inspire so many people because I feel like it's so similar to what so many people are going through, even if they don't know that's what they're going through necessarily. So, what would you say to somebody who feels like they're sick and tired and they don't know where to go or what to do, and they've tried everything, and their doctor keeps sending them home, telling them that they're fine and that their labs are fine, and maybe they just need to stress less and eat better and exercise more?
Right. Sure. Stress less. Good luck. No, I'm kidding. Yeah, I am want to be that. I am that provider who hears that every day. There is another way, absolutely. And of course, connecting with me in the practice, get a first appointment set up. Beyond that first appointment, if I'm not for you and you're not for me, and this is not what you want to do, great. We absolutely go our separate ways. I was talking to another colleague just yesterday about, he was saying, we want to repel as much as we attract. So functional practitioners, it is growing. I believe this side of the profession is getting more awareness. I love that. I hate to hear all of the stories that women have already been through before they get to me. And even though I'm happy that you're here, it's just sucks that I've tried everything else and now I'm here and now I'm ready. I want you to come to somebody like me first, because I
Yeah.
would love to have taken you away from all of the attempted, medications that have left your body really sick, and your body's still paying a price for those side effects and
That
that
just
toxic.
makes your job harder.
It does. It does. But connecting, and I I want to connect at that first appointment. And again, the functional testing, if you choose a different path, great. If you're in it with me, I dig in. I love you before you've walked in the door. And I am passionate about keeping, you on track, because really as women, not that we don't treat men, but especially for women, it's our job to take care of our kiddos. And we really are. I want to change. I was taken to the doctor because my mom just did what the pediatrician said, and everything they said. And every time I got an ear infection, it was med after med. And I want to change that for not only you, the woman in the household, as a mom and a spouse, but for your kids, if you have children, but that really to change that trajectory of their health to where they don't turn into these inflamed, sick adults, right? So when somebody comes in, I'm looking at you now, but I'm looking at where you're going to be in 10 years. And if creating a family is part of that deal, where that's going to take those kiddos as well.
Mhm.
So
So do
that's
you
really.
offer in your practice like integrative therapies as well? Do you prescribe like prescription medication as well when needed, or is it just the alternative therapies and supplements and stuff?
So we use alternative therapies only.
Okay.
However, I do have information if, like I said, when they get their testing back, specifically with the stool test, if they need medication, I have ones that are going to work and ones that aren't going to work. So the labs actually test. Let's just say you do have a fungal infection in your gut, it will test the right ones, and it'll show what's not going to be effective at this point.
Okay.
It does that with bacterial infections as well. So I have that information, but if a person wants to reach out, they would need to reach out to their PCP or other provider, because as a chiropractor, I'm not going to write a pharmaceutical
Sure.
script.
Okay, gotcha. Understand. Okay. So what would you say, because I feel like every autoimmune warrior, as they go on their healing journey, they reflect upon the things that may have gotten them to where they are today. Because um, at least I know for me, I do that. So do you have
Mhm.
any things that you think, as you had just lightly touched upon, antibiotic use in your childhood and stuff, anything else that you think may have contributed to that kind of like onset of autoimmune issues that you had later in life? Or do you think that you're not really sure?
Absolutely. A lot of childhood trauma.
Mhm.
Their sexual abuse as a child, and moving in my teen years when my body started to fall apart. There had been years of living in that stressful space as a little girl. Excuse me. um and then it's interesting because whenever I developed the colitis diagnosis, my husband at the time left me for someone else. We had been trying to conceive, and I'd been on all of these medications, and he was not about it. So yeah, my body had these big stressful events. And by the time I'd reached the later diagnosis of colitis, I'd been in a marriage. I'd been with him for most of my adulthood. We'd been together for 10 years. Um, Everything kind of came to the surface. He left me. We were moving forward with divorce. I felt closure, peace, kind of like the next chapter of my life is about to start. And then my body just fell apart in a way unlike even previous years, if that makes sense.
Wow.
So really tough, stressful, mental and emotional things that had happened. I have been to therapy and counseling for myself to work through those mental and emotional issues. And when we have specifically sexual trauma in a patient's history, I always want to make sure I'm co-managing with their therapist or their emotional support system, because there's so many traumas and stressors that lead us to the autoimmune switch. And it is a switch. Your body, that toxic bucket is full, and your body takes what it can take until it cannot take anymore.
Mm-hmm.
And so I know, and I've done so much research into, the psychological issues behind autoimmune disease. We could probably discuss that on a whole different day. So for sure, trauma. And I do make it a point whenever someone's in my practice, when they come in, we talk about emotional stressors. Recently, like I get a timeline of their biggest traumas, I guess, emotional traumas.
Mm-hmm.
And inevitably, so this is just to give you one example. I was dealing with a woman, she's in her 50s. She's still a wonderful patient. We have been dealing with severe recurring UTI over and over and over and over. And she had been my patient, and I was kind of digging. I said, I just feel like there's something you're not telling me. And she said, okay, I do see a therapist. I've kept it long enough, but I was abused as a little girl. The abuse lasted for 5 years. And there are things physically that happen to me, and it's like the trauma is held in that spot in the body.
Yeah.
The body knows, the body keeps score, right?
Yeah.
And that is where the majority of my trauma is. And she said, I don't think I was clear with you, but you are on my team. You're on my team of care providers that are helping me. And then she walked me through who she's been seeing therapeutically for that. I then sent her to another therapist in the Nashville area that does myofascial release in the GI areas. It's a wonderful hands-on therapy. It's not something that I perform, but she does it all through the gut to release held traumas from your physical tissue. Yeah. So for sure that between abuse and some things of a sexual nature, that was a kicker for me. And of course, when she mentioned that, we both just had this like, emotional moment. But, when she told me that, I said, great, I'm glad to be on your team. Thank you for sharing.
Mm-hmm.
We're going to do some other tests. We did finally get to the bottom of this specific bacterial infection that was creating that. It was all in her gut. We're on stool test number 3 to just follow up and make sure we're still treating appropriately. And then we did co-manage because she did need some medical therapy. Can't live like that.
Yeah.
So it's been fantastic. I've actually connected with her emotional therapist as well. This lady is about an hour outside of Nashville. And she's a great referral source as well.
Yeah.
So I know when she started in, I said, listen, I have some similar traumas, but this part is you've got to get some help elsewhere. This is not just about me stepping in and, doing all the things for you. And she does. She needs a team, and she's treating her trauma from every aspect.
Wow, that's incredible. I love that about functional medicine because it takes a look at the person as a whole instead of, as you had mentioned earlier, you have PCOS and then you're going to your endocrinologist if that's where you go for that. I'm sorry, I don't know. And then you have ulcerative colitis, and so you go to your GI doctor. Whereas if you had a functional medical doctor, you could just go to one person,
yeah,
and they're going to help you
come
do
here.
all the things. Yeah,
right. That's right. That's
yeah.
right. And even when way back before I did this, I was talking with the GI doctor, and I have, of course, when you do your medical history, your intake, my cycles were not great back then. They've never been on track. They've been more on track now in my mid to late 30s and 40s than they ever were in my teen years. And so, I mentioned, I also have this bleeding. So when you have colitis, ulcerative colitis, I'm bleeding out the back end and I'm having heavy cycles. Like, you're in this horrible state. And I just remember I've listed all this stuff, and I even asked the doctor, and he would just kind of looked at me like, well, I don't know. I don't do any of that here, so, and he was the GI doctor. he had done my colonoscopy, and, I was just terrified. And he just said, hey, just, don't go get cancer. Here's 4 meds that can help you. There's nothing you can do to change your diet. I am begging for a dietary overhaul. And keep in mind, at that point, I was just about as skinny as I've ever been. And I'm just going to the bathroom all the time. I just lived there. And so I'm begging for a dietary, do you have a nutritionist? Do you have a dietitian? Do you somebody that can help me? And he was like, nah, studies show there's not a whole lot you can do. Just take these meds. And I said, well, anything about this, my cycles are so heavy and I really just can't live like this. And his answer was, no, do you see a gynecologist? Yeah, dude, of course I see a gynecologist, and it just was getting me nowhere.
Wow.
And yes, whenever I do, we're like, all right, girl, I got you, one-stop shop, because I've already
Yeah.
looked at your body as all the pieces coming
Yeah.
together and holding hands versus, your tummy's over here and your heart's up here and your
Yeah.
uterus is down here, right? So
Wow,
yes.
my jaw is just on the floor. I just cannot believe that doctor. I think so many of us have these stories with these doctors where they just say
Yes.
the darndest things
Right.
and
Right.
just try to dismiss you and send you on your way. And it is really one of the driving forces behind what I did for myself and what I try to encourage my students to do, which is to listen to your body, really. And it's
Yes.
trying to tell you something and to put the pieces together, because everything is connected. So whether or not you can afford a functional medical doctor or you can find one in your area, because that's a problem for a lot of folks. A lot of folks just don't have anybody in their area within driving distance that can do this kind of stuff. At
Right.
some point, you have to kind of take the cards into your own hands. There's lots of doctors that write books on this. You can go to your public library. That's what I did. I went to my local public library here in Portland, Tennessee, and I got stacks and stacks of books when I was diagnosed with adrenal fatigue. Because even my doctor, who's integrative, there was only so much that she told me to do. And I was like, there's got to
Right.
be more. I need rapid healing. I cannot be yawning at 10 a.m. through a workout anymore. I'm just so exhausted. And
Yeah.
and so I did. I read everything that I could read, and I started following all the functional medical doctors I could follow on Instagram and Facebook. And I mean, to me, there are certain things that you can do to study, to learn what is your body trying to tell you to pay
Right.
attention to,
Right.
and then you
Yes.
can start to put the pieces together. And I do think that looking back on your childhood is really important to understand the connection and how you got to where you were, because then you know what not to do in the future.
Right. Absolutely. You want to be kind of that cycle breaker. And two, because I am, raising a family, understanding, oh my gosh, this little thing that has now I see as a trigger. I want to fix that within myself. And then, not put that on my spouse and kids,
Absolutely.
my emotional. So there's the emotional component, and then of course the physical component.
Right.
And I will say, with the functional medicine providers in your area, it really, I know for me, we started to think outside the box because of, COVID-19 and all the restrictions and shutdowns. So, we now treat women all over the country.
Oh,
We do
good.
meetings just like this,
Okay, good.
because even my own practice that I had in the Asheville, North Carolina area, patients that were right down the street from me were, really afraid to leave their homes at first. And so the telehealth concept has really kept things going and keeps
Mhm.
us, being allowed to be connected. So we do treat lots of patients that, they aren't in office. I've got a pocket of ladies up in the Indiana area that are all referrals. And then I still treat out in North Carolina. I've got a pocket of folks down in Florida. It's like one person, you treat one person, and then the highest form of flattery is when they send me a family member or friend.
Yeah.
And then I treat this huge extended family. They're all in South Carolina. And the woman that came to see me first, she has 13 children.
Oh, wow.
That's 1-3 that she has given birth to. So her adult children, and then their, in-laws and siblings, and all of this wonderful family. So, I
They keep you
still,
busy.
they keep me busy. I'm still able to connect because of, telehealth, doing what we're doing right here. It's
I
the
love
Zoom
that.
the age of Zoom now. And
Yes.
so I'm like, oh, COVID was frustrating, of course, from any, of course, hospital, any healthcare establishment, period.
Sure.
But for people like me, it
Hmm.
also helped, hey, how else can we continue to help people?
Hmm.
Because I do believe that this is needed now more than ever because our environments are so toxic.
Hmm.
Our bodies just can't detoxify.
Hmm.
We're just constantly inundated between what's in our water and our air and our food. And so we really are in this toxic state, and understanding how to combat that and then be able to live well and thrive. That's what
Hmm.
we want for our patients.
I love that. So something that you talked about earlier, we're going to wrap up with a little rapid fire questionnaire I'm going to throw at you. But
Okay. Okay, I'm ready.
you had said, I forget what you said, but something about like, oh, when people try everything and then they come to you and you wish that they would come to you first, what are some little cues that their bodies might be telling them that they maybe think are just ordinary signs of aging, or, like having a baby and being stressed out and not sleeping enough? What are some things that folks should be listening to, cues that their body might be sending them that goes, okay, I need to call Dr. Greer?
So I love that, because it does feel like until you're sick enough, you're not going to come to a doctor like me. So a couple of things, any type of course, the fatigue and brain fog, we get that all the time. Kind of like what you mentioned for yourself. You're
Mhm.
yawning by 10 a.m. in a workout, and you kind of know like this can't be right, right? This
Mhm.
can't be right. So fatigue, brain fog, problems with your cycles. Ladies, your cycle, a healthy cycle, should be 25 to 28 days. You should have no more than 3 to 5 bleeding days. You really shouldn't be doubled over cramping and in horrible pain all the time. So many of us don't understand what healthy should be. It's just, well, this is normal. This is how I've always lived. So learning about what your body's trying to say is a big part. So
Mhm.
irregular cycles. And then I have women that reach out that know they want to conceive in 6 months to a year. And so we do that preconception care, which is, yeah, let's get the body cleaned up. Let's
Mhm.
get you in your healthiest state so your eggs can be healthy, so you can be a nice host for that baby. So preconception care is huge. And then really just that first sign of, I've had bad periods my whole life. I myself, I had them. I started at 10. It was seemed way too young. And then they were only 2 weeks apart as an 11-year-old,
Wow.
So I wish, my mom had known back then there are other options. But really the cycles for women, because we get them young, we're under, our mom's care or pediatrician's care. That's a biggie.
Mhm.
And then I'm seeing more and more, hypertension and angina type symptoms in younger women in their 30s that are starting to get that rapid heart rate, palpitations, shortness of breath. And now doctors are using, they may just put them on a blood pressure medication just to decrease all of that. But there's more and more anxiety, and now anxiety is being treated with blood pressure medications.
Oh,
So you're using, because women are like, oh, I don't want to be on some of these
sure.
medications that are going to affect my neurotransmitters. So now they're getting these blood pressure medications, and it's like blood pressure medications just being doled out to younger and younger generations. So
Wow.
again, high heart rate, irregular periods is huge, because that covers just a litany of things that could be happening in your body. Uh, and then GI. Folks, you need 1 to 2 healthy bowel movements a day that look like a soft serve ice cream or an S curve in the toilet. That is normal. When
Yes.
you walk into the door and you tell me, oh, well, my poop's normal, I only go once every week or once every 2 weeks. No, ma'am, that is not healthy. That is not normal. That's not how your body was designed to function. So,
You want
of
long,
course,
slim, not slim, but long, like snake-like logs in the toilet, right? Not small
yep.
little hard
Snake like
nuggets.
that will kind of curve, and
Mhm.
you want it to have well, it's gross, but you want it to have some girth. It needs to
Mhm.
look like a tube. If your stool is flat and looks like, it's literally called ribbon stool. If it looks like a flat ribbon, even if it's long and skinny, That's not good either.
Mhm.
So irregularities in the bathroom, and so many of us don't even know what healthy should be.
Mhm.
So women are like, oh yeah, I came for periods, and I ask about their poop, and they're like, oh well, yeah, I mean, I go, yeah, I'm good. I mean, I go every 4 to 5 days. Oh, so
Yeah.
those are some great starting points if you're
Yeah.
like, huh,
Yeah.
let me help.
I love this. I do a training called How to Listen to Your Body and Give It What It Needs. It's just based on my experience in my life, things that have come
Oh,
up over the
amazing.
years that were like white coating on the tongue and, you know, all the things.
Yeah.
And so these are all, I agree. It's to me, it's as important as working out. It's as important as getting your oil changed in your car
Yes.
and changing the
Yes.
filter in your house. Like all of these things, they're like daily, monthly maintenance things that we should be paying attention to all the time in order to
Right.
know what do we need? How do I fix it? How do I get ahead of it before it turns into an autoimmune condition, before it turns into cancer or infertility? There's so many things that we can do based on the little cues that our body's telling us to help us prevent these things, I think.
Yes. And you have to listen and you have to respond.
Right.
Women as caregivers, we're caring for our families, we're caring for, our partners, we're caring for all of these. Some of us are caring for our parents. Adult women are caring for adult children that maybe still haven't left the home. Like, ladies, you have to listen to yourself. And everybody that sits in front of me or I talk with over the phone or have a Zoom meeting with, they know, well, these heart palpitations started a few months ago, or anxiety attacks, I'm having them alone in private, they started a few months ago. They know, and they just push through. So I really encourage women, hey, stop and listen to yourself. You listen to everyone else, you listen to your kids. I feel like I'm like a Waffle House chef for these kids, just barking orders at me all day, right? We listen to everyone else, but you have to be able to listen to yourself and then respond.
Right.
Um, and I'm literally the guiltiest person on the planet of shoving it under the rug for so many years. And then I'm sick to a point to where there were a lot of years where I thought, okay, I'm not even going to make it to 35, because I didn't know there was another way until I stepped out and got, different education and decided to do
Sure.
this. So listen and then respond. Your doctor will sometimes tell you it's all in your head. And I'm telling you, your thoughts, your heart, they are valid. That self intuition, you are valid. There is a reason something's happening in your body. So even if you don't know the reason, validate what you're hearing, validate what you're feeling, what oh, is that off or is that right? Follow that intuition, because it reaches a point, like you just said, the symptoms stay, and now you have this condition that's developed, and it's much harder once the switch has been tripped,
Right.
right, to achieve some real healing and recovery.
Absolutely. Yeah, and I think that that speaks to the power of community and hearing other people's stories. Like what you're sharing today is going to help so many people. It's going to help the light bulb go off in their head and go, okay, yeah, no, I haven't had a bowel movement this week. And I
You
have
need
blood in
to.
my stool, or I've had periods every 11 days since I was 10. This is going to help so many people. I think that's really part of the also the driving force behind what I do, because when I first started healing myself, and I'm sure this is probably true for you, I felt like I was just grabbing at straws wherever I could find it, searching for
Yes.
information. I really didn't have anyone to talk to specifically. And then I was dumping all this stuff on my husband, and I felt like I was always sick and there was always a new problem. And there's only so much that your partner can really take on and handle. And you don't want to be the
Yeah.
person complaining about your health all the time. But when you're sick all the time, it's easy to do that. So find your tribe, find your community, and just like lean on them, and don't ever be afraid to really like speak your truth and complain to them, because they're going to go, girl, me too. I know what it's like.
Right. Right. And sometimes that's all we need. You just need one
Yeah.
other person to hear you and know that you're not alone in whatever symptoms or struggle you're having.
And
And that's
imagine if that person was actually your practitioner. That's why I love raising up the voices of practitioners that have autoimmune conditions themselves, because you know exactly what we're going through. You're not going to dismiss us. You're not going to, push us out the door with these, regular labs. You are going to fight for us and dig deeper and do everything that you can to help us heal from the inside out. So I thank you for what you do. Like you're gonna make me cry because I just like
Oh.
I don't really know much about you. I just met you at that event, and so I was very taken by you and your story. So thank you for sharing that with us on that day, and thank you for sharing it with us today. I think it's going to help so many people. And so, go ahead and tell us where people can find you and where they can follow you, and the best way to interact with you.
Yes. And thank you, by the way. I was so happy that you came. And P.S. I will be at your event
Oh
with my
yeah.
daughter tomorrow night,
Oh
right? Tomorrow.
yes,
Yes, I
tomorrow.
do. Yes, it is, girl. I'm excited. And I know she's probably not going to clean her plate, so I'll just be taking her food.
Hey, look, I'm making
um,
mashed potatoes and stuff, so there's something she's gonna eat, I hope.
she's gonna love it. She's so excited.
Okay, good.
It's our special date.
Aw.
Yes, I am at Music City Health Center right in Hendersonville. We are located off of Saundersville Road, right in a new office complex over there. We used to be by the Hobby Lobby,
Okay.
but we have moved in the last few months. Gosh, we moved last May. So we're there. We also, so Music City Health Center on Facebook. It's just Dr. Greer on Instagram. I think it's just at DRGREER is my
I think
personal
it's
Instagram.
DR dot because I had to look it up.
Oh,
So
it is a DR dot. Okay,
yeah.
DR dot on Instagram. Thank you. And then, of course, Music City Health Center. We also have Facebook, Instagram page, and we have like fun things going on in the office. But then we have for our patients that are doing functional medicine, we keep a private nutrition page for them, so
Oh.
they get extra care that way. And we do create that Facebook community for our patients because they're not all local and they
Mhm.
don't know each other. So we kind of dump them in this group so they can exchange ideas and thoughts and struggles and recipes. So
I love that.
that's
That's
where
very
to find
cool.
us. So
Well, I'm
yeah,
excited to share your information. I'll put all of that in the show notes so folks can go ahead and just click the links. And I'm really looking forward to hopefully sending some patients your way as well, because I know there are a lot of folks that are
mm,
in my program that don't have access to a functional medical doctor that is within reason. I know a lot of them cost. One of my students just told me the other day, the lady that she found that she likes, I think has a sign-on program. Her membership program sign-on cost is almost $6,000 just to work with her.
mm,
So yeah.
okay.
So I was
So
like, well,
we're not that. We're not that. And I worked with a practice years ago that I wanted to get on so badly, but they this was more than a decade ago, and they wanted that 5,000 starting point to
mm,
move forward. So for us, your first visit is 200.
mhm,
We do sit down and cover all of your history, and then that covers like my recommendations, what we're going to do for you,
mhm,
is that first starting point. And then beyond that, that we do, it is an investment.
sure.
But care plans, just to be really frank, care plans can be anywhere from 2 to 5,000, but that's including your lab work.
Mhm,
Um, and every patient is different with what they're going to need.
mhm,
And if I can get, because we do charge for labs in-house, we do not take any insurance. If I still worked with insurance, I'd never be able to test you the way I want to test you.
sure.
But they're options. So I have people that just they if there is a financial concern, that this is what we can do right now. And I
Mhm,
lay out a plan where, hey, let's just say I want these 4 panels for you, but you know what? This is most pertinent to your case right now. And then we dictate care based on, all right, in 3 more months, we're going to do another panel.
mhm,
So I tell people, it's not an all or nothing. Of course, it's not one size fits all, but it is an investment. So
mhm,
I wish that's kind of the broken system thought process, is that I wish, insurance would help more, but if it did, you'd be no better off.
mhm.
So that just kind of gives you a range, and there's
Well,
not a,
really, I mean, we're paying the same price essentially. Either you pay
yep,
tons of money every month for insurance for care that you probably don't get very much help with, or
that's
you
right.
save that money in your pocket and you go to a provider that doesn't take insurance and you just pay as needed. And
Right.
hopefully the care that provider is going to give you is going to be more in depth and more long lasting and more, as you said, there's a Facebook page with recipes. We're not just going to give you this test and then, give you these supplements and send you on your way. We're actually going to go above and beyond to make sure that wellness is a lifelong practice and not just a for right now,
Right.
let's fix this one acute issue that you have.
Not for right now. And with the insurance, when you come into our office, we don't take it. So you're not going to get a surprise bill in 3 months of something your insurance decided not to cover
Right.
after you thought it would.
Right.
We're dealing with that
Absolutely.
personally from our dentist right now. So I'm a little
Yeah.
frustrated, a little salty today towards insurance companies. But you're not going to get that. Like
Right.
the cost is the cost.
Yep.
It's kind of like CarMax. Like
Sure.
this is the cost.
Yep.
And we want to help, and I am going to fight for you, and I'm going to dig in and want you to walk away empowered, because I don't even want you seeing somebody like me. This is about
Right.
go out, make your own path. Like I want to give you the tools, show you the triggers that you need to understand in your life. But then when you're done, like go take care of yourself.
Yeah.
Right. So that's really my goal for patients, is that they, like you said, there's a lifestyle overhaul, and then you are set up for success to
Yeah.
where you don't have to be in a mainstream doctor's office, and you're not going to need full care for me forever. Right. I want you to be
Right.
able to take care of yourselves.
Right. I love that. So let's do a quick rapid fire question. Just anything that pops in my head, I'm going to ask you, and you just answer.
Okay.
First answer that comes to your mind. Okay.
Okay.
Favorite food?
Favorite avocados.
Favorite drink?
Ooh, mojito, non-alcoholic, anything sparkly.
Favorite song?
Favorite song. It's Adagio for strings, Samuel Barber. It is emotional, it is beautiful, and there are no lyrics, and it will get you
Oh,
every time in the feels, no matter who
wow.
you are.
Amazing. Love that. Okay. Favorite movie?
Favorite movie? Probably Shawshank Redemption.
Really? Okay.
Yeah, it's
That's a
it's a
good one.
little rough around the edges, but I just love his literal redemption. I don't know, that
Yeah.
one always gets me.
Favorite podcast that you're listening to right now, if you listen to podcasts?
Favorite podcast. I don't listen to a whole lot. I'm still new to the podcast world, but I do enjoy what I've heard from Rachel Hollis.
Mhm.
She's fantastic. And I apologize. There is one that is more faith-based, and I don't even know the woman's name. But she's on my Apple feed, and she is great. But
You
that's
have
all
to
I'm
send me that
listening.
after this.
Yes, I will. And I need to get better podcasts that will enrich my life.
Okay, favorite functional medical professional that you follow online?
Ooh, I follow a Dr. Living Good, and I enjoy him. I really enjoy Dr. Mark Hyman.
Mhm.
He really put functional medicine on the map. So I'm not fully in line with everything he says, but I love him for putting this profession on the map.
Yeah,
And then he kind of ekes in, but Dave Asprey, he's not a provider, but you got to
sure,
hand it to him for
sure.
putting functional things awareness out there. So
Yeah, he's
I'm
got a
always
big
interested in
following
what
and
he's
he's
saying.
very like not afraid to say anything.
That's what I like the best. He says the things that I feel like I can't get away with sometimes.
Yeah, yeah,
Even though, again, not a provider, just great for a great supporter of the
sure.
profession.
Okay, last question. Favorite supplement that you're taking right now or
Favorite.
supplement that you're prescribing?
Yeah, my favorite that I am never without. I've actually kind of combined two little tincture for myself. I use a FemAid balancer for my hormones. It's a liquid combination of herbs that really help put my cycles back on the map. It is incredible for me, this age and stage. Like I said, it's called FemAid. We carry it. And then if I can slide in a second one,
Please
back
do.
to the gut, is I use a Cell Core product
Okay.
every single day. It's called Biotoxin Binder.
Okay.
It's simple, no belly pain, and it facilitates that binding of any toxins in the body, binding and then release. So I use
Huh.
that every single day to keep my
Is
belly
it
on.
like a charcoal-based binder, or do you have
It's
to
not
take
charcoal. It is
okay.
dark. It's fulvic acid and humic
Okay.
acid. So it's soil based.
Okay.
It's very similar concept to
So you
charcoal,
don't have to
but
take like a stool softener with it.
no, you
Okay, good.
don't. And I have used charcoal and gotten really backed up before. So
Okay.
it's also nutrient sparing. So it's a little more selective. And
It's not
I
going to
just
grab
love it.
everything. It's just grabbing what it's supposed to.
Correct. And
Okay.
if you
I love
know
that.
you're going to be a little more free, especially if I do decide to consume a healthy cocktail,
Mhm,
I take an extra just to make
mhm.
sure I don't have any as much trouble. Alcohol is never great for us, but
Yeah.
if we indulge, but it's fantastic. And so
Okay.
post cleanses,
Okay.
that's what I use to keep things going,
Very cool.
moving my body.
I love it. Well, thank you so much for being here with me today. I really enjoyed it. We're going to have you come back for a whole parasite discussion, and let's do a trauma discussion as well.
Yeah, it's going to get, just bring your tissues. It's going to get, yeah. Thank you so much. This was so much fun today.
Yay. Well, have a good day. I'll be chatting with you soon. Thank you so much for tuning in for another episode of Edible RX, the podcast that teaches autoimmune warriors to use food as medicine. I hope you enjoyed this episode as much as I did. If you have any questions for Dr. Greer, go ahead and follow her on social media. I've posted all of the links in the show notes so you can find her online. You can use her telehealth services if you're not in Nashville. You can visit her in Hendersonville if you are. And until next time, guys, eat your damn vegetables. Bye.